I was working in the winter of 2022. It was like January 6th, and we had just had a big ice storm. I believe it was 2 days prior. Everybody regionally, all the way down to Boston, was grounded. We worked with DCF. I was an in-home social worker, but we had a brand new client that had just started with us. As you're leaving the city, headed more towards the highway interstate route that I was going to be taking, and I always continued straight instead of turning right. This is the last thing I remember before the accident happened was I cannot go straight. I'm on a time crunch, and I kept going right. And I black out around then. My memory just kind of stops. The belief is that I hit black ice and that I may have sneezed at the same time because my head kind of went down. Essentially, I did a complete 90-degree turn into a trash truck. There was a trauma doctor on, I believe his name was Dr. Parisian, and he called in orthopedics, which is Dr. Houseman. My shoulder was internally separated, I guess is what they said. As far as I knew, everything was so damaged internally that they couldn't save it. So they decided to do a 4-quarter amputation. That was where Dr. Quinn kind of helped come in and the vascular people. And that was when the two of them decided to do the nerve freezing.
Once we decided that this was necessary, my colleague and I, Dr. Curtis Quinn with thoracic surgery, ultimately we decided that this was going to be something that we would try to provide the patient with temporary pain relief. We ended up using the cryoablation and cryo nerve block on the brachial plexus on this patient's upper extremity, only to find out that what we thought was going to be temporary ended up being a permanency of phantom limb pain prevention.
The hope was that this pain relief would last for, they were hoping 6+ weeks, if not a couple months. It's been 4 years as of this last January.
In our experience, patients that have undergone cryo nerve block at the time of their amputation have had decreased residual limb pain at the onset of surgery, decreased need for narcotics, shorter length of stay. Patients are coming back for their postoperative recoveries and even in their acute postoperative period, and all staff are recognizing that these patients are more comfortable, that they're tolerating physical therapy well. Their quality of life is better, and most of the patients that we've recognized with this have noticed a considerable improvement with their ability to recover.
I've never been in pain. I was off all pain medication within 2 weeks of being home. I've never dealt with depression or anxiety around my amputation. It was just kind of something I accepted, and I don't know if I could have done that if I had to deal with the pain. After talking to some of the amputees I've met in my in-person support group, the pain that can cause issues within your own system, it's unbelievable some of the issues that they've gone through, that they're hospitalized constantly, they're on hundreds of different medications. Hopefully I never will, because we're gonna be coming up on 5 years next year, and this nerve freezing has continued to stay the same that it always has.
In my opinion, cryo-XT and cryotherapy is going to change the way that the gold standard is approached towards amputation of a limb. This is not going to change the procedure, but what it is going to do is it's going to take away the worst complication that can come from it. The management of pain, whether this is post-surgical or long-term pain associated with phantom limb, this is something that can be the reason why patients ever regain independence. They can ever return to work. They can ever go back to where they were before this disease process. So ultimately, this is going to be one of those elements that is going to change the way that the patients can reintroduce into their normal lives.